Happy Friday, everybody. It's already the middle of August, and we are live again here. The location may look a little different to you, but it's familiar to the patients who have already seen me and had consultation or services with me. We're in my waiting room, and here we are. I hope you're all well. Today, we're going to talk about part 2 of the neck. But before we get started, we have a very important update. Nala's birthday is coming up in a couple weeks. So we're going to have a little birthday hat for her. We might have some pup cakes for her. So be on the lookout for that. We'll certainly post it on our Instagram and on Nala's Instagram as well. So follow this office at JKimMD Facial Plastics on Instagram and JKimMD on Facebook. Tell your friends, and let's get started. The first thing is the word of the day. So the word of the day is lift, and we're talking about necks and how we can make them look young and refreshed and keep them that way. So this is our office number. Text the word lift, and you will receive, or you will have a chance to receive, a free skincare package. This is a gentle cleanser from Elastin. It's my favorite face wash. Very gentle on your skin. Does not dry you out, and does not have those beads that you really should not use on your face, like St. Ives. So very good facial cleanser. Then next you would go with your hydrating toner from PCA Skin. I love this product. It's very moisturizing, especially right after you wash your face. It really holds in the moisture of your face as you apply your corrective skincare products, including like your vitamin C serum and or other brightening serums, things like that. Okay, since we're talking about necks, we have a neck product that you could win. This is not a cheap product, but it's a very good product, and a little goes a long way. It's our Elastin Neck Restorative Complex. This is good because as we get older, we have little necks. The stretchy of our neck skin doesn't bounce back. So, when you were 18, it would go boing. But if you were in your 30s, 40s, sorry, even 30s, you get a little bit of the laxity as the skin does not bounce back as readily as it used to. It might even hang a little bit. So this is a great cream for that. It works on elastin. So everybody knows about collagen, but not too many people know about elastin. Elastin is the fiber in the tissue of your neck that gives your neck the bounce back. So what this cream does is it helps reorganize and replenish that elastin for your skin. So great product, one of my favorites. And then lastly, we're going to have some sunscreen. In the DC area, summer is still pretty high. It's raining like crazy on some days, but when the sun's out, it's 90s. So better put on your sunscreen. This is for all skin types. It goes on very nicely. Keeps the moisture locked in, keeps the effectiveness of your other skincare ingredients locked in. So good stuff. It's a mineral sunscreen, so it's not made out of those chemicals that can seep into your bloodstream. Again, we don't know the clinical consequences of that, but what we do know is that it's better to have natural ingredients in your sunscreen, and the top 2 ingredients in here are zinc and titanium. So these are natural minerals which are in your body already, so it just reinforces that. It's a nice physical barrier. So there you go. All right, neck part 2. Last time, if you tuned in, we talked about non-surgical options for your neck. Okay, we talked about different energy-based treatments. We talked about filler materials to get into the wrinkles of the neck. We also talked a little bit about radiofrequency, microneedling, things like that. Okay, and now today we're going to talk about surgery. Okay, so there are 2 major elements of the neck that we can help with surgery. Okay, over time, what you have is this fat pad below your chin, or under, just behind your chin, and over time that tends to come down. Okay, time and gravity are just as inexorable as death and taxes. Sorry to be so morbid, but the chin fat starts to come down. Okay. And the other thing that may show up is that these cords in the neck, from this muscle called the platysma muscle, okay, this muscle can get weak and start to droop, And what you end up with is 1 cord or 2 cords. Okay. So how do you help those 2 features? Okay. So the first thing that we can do is liposuction. So for the fat that is between your skin and this muscle, okay, you make a small hole incision and then you put in a suction cannula and you gently sculpt this area. Okay, sculpting, not completely removing, because you need a little bit to still have that youthful look. If you overdo the liposuction, you look thin, and we call it actually a cobra neck, where it looks like this, and the skin's stuck right to your muscle. That's a no-no, and that's a dead giveaway that you've had surgery. So liposuction by itself is performed in the office, and it can be done with a little bit of relaxing medicine by mouth and a little bit of numbing shot. Usually it takes about 45 minutes to an hour, and we make sure that all the proper areas are addressed and that the skin drapes over nicely. Okay. Liposuction by itself, here's the thing. If you have extra skin and by doing liposuction you deflate the balloon, what are you left with? A pruny balloon. So, if you have extra skin on top of the extra fat, then you want to take the next step, okay? One of the complementary steps that you can do is the radiofrequency microneedling, which we talked about last month, okay? Radiofrequency is a form of heat energy, and when heat hits tissue, it contracts a little bit. So you get a little bit of that tightening effect to complement the effects of the liposuction, which have deflated this balloon. Okay, so that way you still have a taut balloon or a tight neck, to fuck the analogy. The other thing that we're talking about is neck lift and or lower face lift. Okay, so in terms of the neck itself, when you have the muscle cords and or the fat drooping down, what you can do is actually surgically manipulate them so that you have a more youthful look. Okay, we did this actually yesterday for a beautiful patient of ours. She's in her mid-60s. And so basically, the way that you sculpt the neck is you go through here, same access point as for the liposuction, and you access the platysma muscle here, okay? And there are different ways to do this, and there are as many methods as there are surgeons in terms of improving this area in terms of the muscle. Some people excise the muscle, some people tie it together. Again, it depends on the preferences of your surgeon and also the patient's anatomy. But basically, what you're going for is less of the heaviness and less of the corded look and a nice angle from here to here, down to here. Okay, so who are some good candidates for facelift surgery? If you have a voice box that's relatively high and far back, it will complement, or what will happen is it will yield a nice sharp angle right here. Okay, so a nice number 7, kind of like this, sorry. If you have a voice box that's more lower and more forward, what you'll end up with is kind of a more oblique line, which is still an improvement, but won't give you that really, boom, boom, taut look that somebody with a more high and backward positioned voice box would. In terms of the recovery, okay, after liposuction, you're talking about a little bit of bruising and swelling, just like with Kybella. However, after the liposuction is done, and the swelling starts to go down, it'll go over your collarbones and basically fade to nothing. That takes maybe about a week, 10 days. You wear a chin strap for a good part of that time just to help the healing process, but after that you're good to go. In terms of facelift and neck lift, you're talking about really substantial anatomical changes under your neck, and so the recovery is a little bit longer, but generally I say 3 weeks until you're restaurant ready, 3 weeks until you're wedding ready. Those are kind of the general things with regard to surgical procedures for the neck. There's one of my favorite things to do because it really turns back the clock. One question people ask me about surgery is, how much younger will I look? The general answer is about 10 to 12 years, okay? And so you go from, kind of a heavier, more rounded neck to a nice jawline and a really nicely sculpted neck. So that can really take the dial and really crank it back about 10 or 12 years. So good results, definitive results. As a surgeon, I'll be perfectly honest with you, my bias is towards surgery. That's what I grew up with, that's what I trained with. Those are the results that I've seen and are proven to be reliable. Surgery is not for everyone though. So if you can refer back to last month's live where I talked about the non-surgical options, you have plenty of things to choose from. Again, one procedure may not be for everyone, okay? So for some people I say surgery is a good option, but for other people I say other non-surgical things are a good option too. So it's really depending on your age, your features, your preference. And so, this is not a be-all, end-all for everyone, but definitely, you want to come in, talk with me, meet my staff, and have a candid conversation with us about, what changes you're seeing in your neck and what you would like to improve. With that, we'll have some questions from the live chat.
Okay, there's a question where a patient was, where would be the scars for facelift?
So for facelift scars, there's one scar under your chin. It's right in the little wrinkle just behind your mentum, or the front part of your chin. So if you go like this, you'll see one right here, and so the scar would be there. It'd be about 1 centimeter to 1 inch long, depending on the work that you have to do under your chin, okay? And then for the facelift part of the surgery, the scars are around the ears. So it's a very small portion of it is actually visible. So this part is in the hair tuft, okay? And you need this area to work on this part of lifting your face and lower face for the surgery. And then there's an incision right in front of the ear, hugging this little cartilage called the tragus, and going around the earlobe, up the ear, and into the hairline. So we call this the touch point where the top of my ear meets my hairline. So I'm going to hide the scar really high up behind my ear where you cannot see, and then I'm going to hide the rest of the incisions in the hair. Okay, so the only visible part that you end up seeing is right in front of the ear. Now, I've seen some patients who have already had facelift surgery and they have ghastly scars, so they can never wear their hair up. You can see the scar from here to here, and it's a dead giveaway that you've had surgery. You don't want people to know that you've had surgery, right? You just want to look more refreshed, and then you see people again and they're like, oh, did you get a facial? Or did you have a vacation? That's the way you want to feel, and that's the way you want people to see you after you've had surgery, not, oh, have you been operated on? So that's my way of hiding the incisions as much as possible. Again, for fair-skinned people, the incisions hide really well. For slightly darker-skinned people, you may need a little bit of assistance. That's why we have a silicone cream readily available, and it's a nice additive that we've brought into the office. It's from Biocornium, okay? And silicone-based topical treatments are a great way to hide scars regardless of how old these scars are. Okay, you wouldn't put it on a fresh incision, like a week or two after surgery, but anything like 2 months or after surgery, even years after surgery, or even if it's just a cut that you had from, from another injury or accident, this works really well. You put it on twice a day for about 2 months, and you'll definitely notice a difference. Some people would be helped with that, but most people don't need it, and the scars heal really, really well.
Okay, another patient asks, can I get liposuction with facelift?
Yes, absolutely. So if you have a heavy neck and the jowling here, and you want everything lifted up, if you lift up and the balloon, there's still too much fat or content inside the balloon, then you won't have as good a result. So what you can do at the time of facelift surgery, if you want this and you want less substance here, is you can do the lipo at the same time. Absolutely. For some people, the fat is in front of this muscle. So in that case, liposuction works great. For some people, the majority of the fat is behind that muscle or deeper than that muscle. So what you have to do is actually go there, remove the muscle directly, because if you just blindly put in the lipo cannula, you're not sure you're getting that muscle all the way. So what we do oftentimes is we do some lipo, but in a fair number of cases, we also go under the muscle cords and we remove some of the deeper fat. So you have a nice long-term result.
Okay.
So we're going to put up a result for one of my patients. She's in her mid-40s and she's of Asian descent. And what she did not like about her neck was that it's heavy, okay? She didn't really have the cording that some other people have, but you can see the lower cheek is a little bit heavy, and also there's not really an angle. It kind of slopes down from her chin down to the collarbones. Okay, so we performed surgery on her, and this is just 6 weeks later. So she's very presentable. Okay, you wouldn't know that she had surgery just by looking at this area. But again, it's a nice refresh, nice change. You know, people ask her, hey, did you get a facial? Did you go on vacation? So that's a nice look. Again, you'll see a little bit of the scar right here. Okay, and for darker skinned people, that can be a little more visible, especially during the first couple months after surgery. But you know, we can see how it goes, and well, we see how it heals. Usually, they heal really, really well. Again, these incisions are hidden. The ones in front of the ear are kind of hidden in the fine lines that run parallel to the ear. So again, very nice result, I think. She's very happy. I think she's coming back for her 6-month follow-up soon, so we'll have pictures of that as well. Again, this is a very gratifying surgery for the patient. It's kind of a longer surgery. It's a few hours long, but it's time well invested in terms of your facial rejuvenation and your beauty.
Okay, Dr. Kim, it seems that there's no other questions. Do you have any other comments for the audience?
Let's see. Fall is coming, so please be on the lookout for our Fall Into Beauty promotions. We're going to have a private event, and if you're on our email list, you'll get an email about that as well. If you're not on our email list, please email info@jakimmd.com, info@jaekimmd.com to get on our email list, learn about specials, learn about me, learn about our staff, just get to know us, you know, and how we can work with your beauty to help you achieve your goals. Please don't forget, text the word LIFT to our office number, and you will have a chance to receive these 4 great skincare products. I would recommend the neck to basically anyone, you know, starting to see a little bit of the saggy. That includes me, and I'm in my upper 30s, so this is a great neck cream. Sunblock's always a must, and then the toner is great before your skincare products. And this humongous product, the facial cleanser, I've been using it for 6 months every day, and I still have some left. So a little goes a long way, not just for this product, but for all the other products. So that's it for us from here. I think we'll be broadcasting our lives from here for the next little while. A little bit of a change of date in September. I'll be away from the office on the 3rd Friday of next month. So we will find another Friday to do this, so be on the lookout for that. Again, follow us and get your friends to follow us on Instagram and Facebook. Until then, stay safe, stay cool, stay healthy. Thank you, and we'll see you soon. Bye.